first speaker is going to be Dr. Bob Williams from Bath University. Now, I had to write something down because I'm not going to remember it. Grace is supporting him in research under the title Development of Novel Gene Reporter Assays to Measure APP Processing in Neurons, a new platform for screening protective molecules for Alzheimer's disease. You'll understand, having read that out, I'm not going to try to tell you what he does. I'm simply going to hand over to him and let him speak.
So, what I want to do this evening is very briefly tell you about the status of treatment for dementia. I'll talk very briefly about current treatments, and then I'll present very up-to-date information actually on the status of some of the latest developments in our attempts to combat the disease. Now this, if you see this strange-looking green creature here on the screen is a brain cell. And this is a specialised brain cell called a neuron. And if you look carefully at this picture, you'll see this very large green central part of the cell, and that's the real sort of, that's the main machinery part of the cell. But hopefully you'll also see that these cells are dotted with these other very bright structures, and there's thousands of them. Now, the fully mature adult brain has over 100 billion of these nerve cells. And each of those 100 billion nerve cells can communicate through these little tiny structures here with thousands of other cells. And these little structures are absolutely key to normal brain function, because it's at these tiny structures that all the chemical communication events that enable higher brain function to work occur. Now, as we age, unfortunately, we start to lose these structures. These structures are called synapses. And that's a normal part of brain aging. But in diseases such as Alzheimer's disease and other dementias, that loss of these structures is very rapidly accelerated. And it's the loss of those structures that then gives rise to the symptoms that we associate with disease. Current treatments, therefore, are aimed at trying to address the chemical deficiencies that result in the brain as those structures are destroyed. Okay? So this is another image. This image actually comes from a human brain, a post-mortem brain. The top image shows a normal brain, and those brown cells are normal functioning neurons. The picture at the bottom shows an image from someone who had Alzheimer's disease. And you should be able to see, you don't need to be a trained neuropathologist, I don't think, to see there's less brown cells on the bottom than there are on the top. And this loss of cells is a problem because the loss of cells then interferes with normal brain communication. So the therapeutic strategy is to try and maintain brain communication and try and make an allowance for the loss of these cells and the chemicals within them. And some of you may know that the key chemical that's lost early in Alzheimer's disease and many other dementias is a chemical called acetylcholine. And current treatments, and some of you might be familiar with these, are targeted at maintaining acetylcholine levels. So there's Aricept there, Exelon and Remenil, 3 currently prescribed drugs, all work in the same way. So the aim of these drugs is to maintain acetylcholine levels. There's also another licensed treatment for Alzheimer's disease called Bixa, or memantine. It works in a slightly different way, but the principle's the same. So these 3 drugs in the middle there are diagnosed for mild to moderate Alzheimer's disease. Bixa is for moderate to severe Alzheimer's disease and is often given to those who can't tolerate the acetylcholine drugs very well. So that's the current treatment setting for Alzheimer's disease. Now, there's a major limitation to these existing treatments, and that is they clearly do provide some benefit against some of the symptoms of Alzheimer's disease, some of the dementias, but they do not prevent progressive brain damage. So they are not disease modifying. So while you're giving these drugs to try and maintain the chemical balance in the brain, you're doing nothing to effectively slow, inhibit, or ideally halt the progression of the disease. because of this drug approach is rather limited in its scope. So, the key here is the need for disease-modifying treatments that can actually perhaps delay the onset of disease or inhibit the actual progressive damage to the brain that we see during dementia. So how do you identify new targets that can impact on disease progression? Well, work over the last 20 years or so has focused primarily on a protein that builds up in the brain. It's a sticky protein, it's called amyloid beta, and it accumulates in the brains of people with Alzheimer's disease. And for a long time, pharmaceutical companies have designed strategies to try and attack amyloid beta, either to prevent its formation or to eliminate it from the brain. So amyloid beta has really been the focus for most pharmacological drug design targeted to Alzheimer's disease. It's therefore the little bit of regret, and the timing of this is quite extraordinary actually, that the front page of The Independent today, and some of you might have seen this, was a really rather unfortunate headline, which is that drug giants give up on Alzheimer's cure. And that headline arises from the recent failure of some key clinical trials which have developed anti-amyloid beta strategies. There was an immunisation type trial where patients or affected individuals were given antibodies essentially against amyloid beta, and it's not had the hoped for outcomes. So what next? Because that sounds rather negative, and actually I want to give you an optimistic message. Those headlines suggesting nervousness in the pharmaceutical industry, I think, are understandable. But rest assured, amyloid beta remains a key player in Alzheimer's disease without question. Amyloid beta does accumulate in the brains, and it's almost certainly an important trigger for progressive neuronal loss. So I think research will continue to look at amyloid beta and find perhaps more appropriate ways of targeting it. There are other targets. I don't want to go into fine detail here. If anybody's particularly interested, I could deal with that in the Q&A session. But our eggs aren't in one basket. We're not focused only on amyloid beta. There are other issues to address. If you look through the list there, you'll come towards the bottom 2 points. One being vascular effects. I think there's a lot of interest in looking to maintain blood flow to the brain and provide vascular benefit as a therapeutic strategy for Alzheimer's disease. And also there's a lot of interest in lifestyle factors. That's of interest to me because I do have some research programs looking at dietary factors and the risk of dementia. These are laboratory studies, so they're in model systems in the lab, but we've found that certain molecules that are very common components of your diet, present in fruits and vegetables and other things, can have quite beneficial effects in protecting brain cells from progressive damage. These laboratory studies, they're a million miles away from drug development, but they do offer some hope because within the world of plants and natural products, there are chemical structures that could provide the basis for new drug designs. That's an area that I think is still worth developing. However, I do want to say that aspects of this field are rather overhyped in the media. And I'm sure you might feel this yourselves, that you often come across headlines in the newspapers, on the radio, making very elaborate claims for commonly encountered dietary foodstuffs such as coffee, chocolate, and fish, and so forth. And again, I can deal with the basis of all of these strategies in the Q&A session if you're interested in learning more about specific dietary interventions. So I'll finish with a challenge ahead of us then. And from today's headlines, I think we have to consider the fact that the current drug pipeline coming through the pharmaceutical industry sector is unlikely to deliver the hoped-for magic bullet to cure Alzheimer's disease. Okay? However, I think we can be optimistic that new, effective treatments for aspects of dementia will emerge with time. There are new treatments in development, but we need many, many more. And the only way we're going to get that is by increasing research activity in all areas related to dementia. That includes understanding the cause of dementia, better diagnosis of dementia, the next speaker will deal with, and developing really strategies based around understanding the mechanisms of dementia. And I think, I'd like to add a final word that the charities are going to play an increasingly important role, I think, in supporting that basic research. Thank you very much.